If your child is getting stronger prescriptions year after year, don't just get new glasses. Hey, it's Dr. Pillai again. So there's treatments that can help save children's vision. So if they're myopic, meaning they're nearsighted, and the prescription is continuously progressing, you don't need to just keep getting glasses. There's treatments that can help slow down that progression. One of them is called Ortho-K, which utilizes a gas permeable retainer that looks like this, that the child wears just while they're sleeping. So they put it on at bedtime, in the morning they take it off, and then they'll be able to see clearly without glasses. Really amazing, right? But more importantly, it actually helps slow that progression down. So instead of your child going from a -2 to a -3 to a -4, eventually into -10, this can help slow that progression down so they don't get into those pathological myopic conditions. Other options include daytime soft contact lenses. The one that's FDA approved in the US is called Myopia. It looks like this. These are very similar to traditional contact lenses in terms of how they feel and how you put them on and take them off, but the optics are vastly different. So when the child puts on these daytime contacts, they'll still be able to see clearly, but the optics provide peripheral myopic defocus. I know it's a fancy term, but that's how it helps slow eye growth to make sure the myopia doesn't keep getting worse. Another option is eye drops called atropine. Now, atropine is a nightly dose, so the child just puts them on right before bed, and atropine actually helps slow the axial length, how much the eye grows. Atropine looks like this. When I talk about axial length, what I'm talking about is the eyeball. So this is the eyeball. This is what a normal eye size looks like. This is what a myopic eye size looks like. So you can see that it's a little bit longer. And with children, as their body grows, they become longer and longer, so that myopia can progress. And all three of these treatments can help slow that progression. So there's orthokeratology, which again utilizes a gas permeable retainer that looks like this. There's also MySight, which is the FDA-approved soft contact lens, which looks like this. And there's also atropine eye drops that the child puts on at nighttime, which looks like this. Now, atropine comes in many different concentrations. The one that I always recommend to my patient is 0.05%. I've seen it being prescribed at different concentrations from other doctors, as low as 0.01. A lot of the studies actually show that 0.01 isn't as effective for the eye growth portion. The other issue with atropine is that it has to be compounded, so what kind of formulation are you getting? So that's always something to be aware of when you're dealing with these compounded medications. In my clinic, I have most of my patients, I would say 95% of them, in Ortho-K, not only because it can aggressively control the myopia, but it also allows for that child to be free of glasses during daytime, whereas their parents absolutely love that as well. So I hope that answers questions of why to use other myopia control treatment options instead of just getting new glasses for a child every year.